Evening News at 5.
The COVID pandemic has highlighted inequities in America's healthcare system. The American Medical Association has been working towards health equity and recently released a 3-year roadmap. We're now joined by Dr. Aletha Maybank. She's Chief Health Equity Officer. Doctor, first thing is not anything that's new. This is just something that became apparent during this pandemic, right?
Absolutely. I mean, I think if there's one thing that has been helpful, during this pandemic is shedding a light on these inequities in health that have existed really for centuries and for hundreds of years. And to really highlight, the differences that communities have in not only receiving care, but also the various different outcomes that they can have in care and how they get disease. And so, the AMA, the American Medical Association, that represents 270,000 physicians across the country and is one of the largest physician organizations in the country, really set out on a pathway a few years ago, about 2 years ago, to say we need to really commit to equity work and be very strategic about it. And so they started a Center for Health Equity, and then they had their first Chief Health Equity Officer, which is me. And so we've been working on this plan for the last 2 years. And so then when COVID came around, it just provided even more fuel for the need to have a strategic plan and a roadmap that really spoke to how do we ensure that all of our communities and people have resources and they're working well, that we're not doing any harm, and we're not creating even more harm that may be existing right now. And that everyone has the same power and the conditions and the resources and opportunities to achieve optimal health, and that our physicians really have the tools to help support doing that.
This is really a 5-step plan and 3 years to implement everything, pretty much is what you're saying. Give us an idea of some of the ones that are really top of mind right now.
Yes, and so we set up the roadmap for 3 years, but understand, this is a journey. Doing any kind of anti-racism work, social justice work, we all are kind of living forward in that legacy that has been passed down to us. So we understand this is a long game. But in the short term, the thing that really stand out, and it was mentioned at the top of the show today, is about the embedding equity into our own practice and culture as the AMA, saying we can't do equity and justice work with partners on the outside of our institutions, with residents and with patients, if our own teams don't even understand what does equity mean? How does inequity show up in the decisions that we make? How are we using power in a good way, power not in a good way to make decisions? And so the inside work, the inside-outside strategy becomes really critical to advancing this work of equity on the outside of the organization. And then I think the other really key part is around building alliances and sharing power, really centering the voices of those people who have been marginalized and harmed historically right at the center of our decision-making process, whether it's at the healthcare system level, the hospital level, for physicians and practices, and for us as the AMA. And then I would say lastly, I think the one that really, I think, sparks a lot of energy really for me is fostering pathways for truth, reconciliation, and healing for our past as AMA. We're known to have excluded Black physicians for over 100 years from the American Medical Association, and you can imagine that has created some harm. We did apologize for it in 2008. However, there is still much more that we can do, and that was really the very beginning of our efforts of reconciliation. So we really have to better understand kind of the costs and the impacts of the harm, and then figure out how we're going to repair that harm.
How tough do you think it will be to reach these goals in 3 years?
Well, again, I think we have these overarching strategic approaches to do and to set out in 3 years. Within that, we have strategies and activities, that we're going to meet so that, understanding that this is a long-term game. Mm-hmm. It's going to be uphill to some level. I think there are opportunities that we see right now, and there's a lot of movement in medical education to help train, med students, train other physicians on anti-racism. So there's things that are going to happen, I think, more easily than others. But looking at changing systems and really dismantling racism, it's hard to do in other systems in our society. So healthcare is going to be just as challenging as well. And we have a lot of work to kind of bring everybody up to speed on what these concepts mean and how they show up.
Dr. Aletha Maybank, Chief Health Equity Officer, I should say, with the American Medical Association. Be safe, be well.
Thank you.
Checking out with